first I'm going to begin by observing the patient's abdomen, looking for asymmetry, for discoloration, any sort of hair pattern that may be abnormal or atypical, any swelling. I see none, so that is good. The abdomen is a little bit special because we have to I can do it. I just can't do it. Keep going, I don't really care. Because you have to auscultate right away. So I'm going to start with the diaphragm. Yep, I put them in the right way. And I'm going to start and go around in a clockwise motion. Listening for 5 to 15 seconds in each spot. Then I'm going to flip it around, do the same thing. Bow.
Let's see. I'm going to go on just, I'm going to start percussing. I'm going to go down the center, mid-clavicular line, axillary line on both sides. So.
Then I'm going to listen to the liver and the spleen for friction
that I hear from tympanic to dull as you go over or resonant, going over the different organs, regions.
She's good. I didn't hear anything abnormal. Her tummy's making some cool noises though. The next thing I am going to do, I'm going to put this back in my ear and I'm going to listen for some breeze.
Now I'm going to just find your lateral border of your
I'm going to start with the abdominal aorta.
I'm going to start near, close to your nipple, and then I'm just going to kind of
Then I'm going to move to the renal arteries.
And then go up from the bottom.
I didn't know what they were called. I knew where they were. Then the iliac arteries. Can you locate your pubic symphysis for me? Go from her ASIS, halfway in between her symphysis, along the inguinal ligament. Listen to the femoral artery.
If it was over 12.
Bilaterally. Don't mind, I'm just going to do this over here too.
And I'm going to go to your spleen. I'm going to do a similar
I don't hear anything, so that's spectacular. Then I'm going to percuss the abdomen. Going to go mid-axillary line, mid-clavicular line, and midline.
And the diaphragm would push the spleen down if it was abnormally large. I did not feel any or hear any dull sounds.
I'm sorry,
You can continue with the bruise. I'm going to listen over a couple of arteries, your abdominal aorta, renal, iliac, and then your femoral.
I know this doesn't feel the best. One thing I forgot to ask is if the patient recently emptied her bladder or bowels, because that'll make a different noise when you are percussing if they are full. The next thing I'm going to do is I'm going to do the spleen percussion test. So I'm going to have you take a deep breath in and out. Didn't change noises, so that's a good thing. That's how it should be. And then I'm going to palpate her liver. So breathe in and out. And in. Good there. And gallbladder.
Just gonna
breathe
try and feel
and out.
the kidneys. See if I can.
Good there. And then I'm going to do gentle palpation,
Let me know if there's any pain.
which I should have done before what I just did, but I didn't.
Press too much.
Any pain with any of these?
Not really feel that. Slowly
And
back
then
here.
Palpate a little harder.
Feeling any of those.
And anything there?
Of your liver.
Oh, good.
I'm just going to
All right, and then I'm going to palpate the spleen, or attempt to palpate the spleen. I shouldn't feel anything.
And go ahead and let it out.
Because that would be bad.
Let me know if there's any.
And we're good there.
Go ahead.
And then I'm going to try and palpate the kidney. So I'm going to come here,
Trying to relax.
drag out the tissue slack, and I'm going to squeeze down. Is that okay with you?
Is this the right pressure? Okay.
And I can't feel much of anything there.
And I
Then,
did sort of feel
go back to the
my left hand
percussion,
of the liver pushing
because I
down on
missed doing the
it, but it
liver
wasn't
size,
too
you know.
much.
So we're gonna start
So,
here.
we're gonna keep going. I'm gonna feel
There it
the
is.
abdominal aorta, a little bit of palpating that.
I'm gonna put my ruler down. She wants to hold it, so that's pretty cool. And then I'm gonna come up from the bottom.
Feeling the lateral borders. Measure this one as well.
And there. And I'm gonna flip it.
And it's under
And
3.
I'm gonna
It's
measure
2.5, maybe between 2.5 and 3.
And I got 9,
You do not want it
which is
over
what I got
3.
the other day.
That
So
suggests an
your
aneurysm,
liver isn't growing, so that's
abdominal
good.
aorta, but you're all
And
good.
then the next thing I'm going to
Now,
do is the appendicitis test.
I'm gonna just start palpating your around your stomach. I'm gonna start.
Well, I got my ruler handy. Probably measure the abdominal aorta. Going to feel for where the pulsations feel equal,
Let me know if I'm pressing the right too.
and then measure it. It's about 1.5 centimeters, I'd say. Then I'm going to do the appendicitis
Feels really good.
test.
Now I'm just gonna go a little bit.
Start with
deeper.
McBurney's point. Do you have any appendicitis symptoms? No. So these shouldn't
A little
hurt
bit
her.
of
No.
almost
The rebound test.
spot of your large intestine.
The test that starts with a V and I can't ever remember how to pronounce. And then I'm going to have you, actually, I'm going to bring this up and flex your knee. And do you feel any pressure?
And if
This
I
is
would've
the
felt
obturator
any
test.
hernias, which I didn't, or any
And then I'm going to
masses,
have
I
you
would
lay
have
on your
the,
side, pull your shirt
cough.
down.
And if it went away,
And then can you
that
bring
would
your
be
leg back until it hits
stand
me?
up and was
And
more
keep
prominent,
pushing.
that'd be intramural.
Any pain with that?
Didn't feel any,
Nope.
so we don't have to
Good.
do that.
No appendicitis. That was the
There
psoas
was
test.
no appendicitis.